So with this, let me, hopefully Eric Bernstein is here, and invite Dr. Bernstein. He is a dermatologist, world-renowned laser surgeon with academic interests. He was in our faculty at Thomas Jefferson for many years, and currently he's in a private practice in Philadelphia suburbs in Ardmore. So Eric, if you are here, why don't we move along? And there he is, world famous. He's probably in Dubai right now, it looks like.
No. I'm right here. I'm right here.
So thanks for joining us, Eric. Please go ahead.
If you stop screen sharing, I can share. It won't let me share while you're sharing. There we go. So let's see. Here we go. All right. I'm ready to roll. Well, that was actually fascinating. I knew a lot of that, but I'd forgotten a lot of that too, because I'm out of the lab. The whole reason I do research in dermatology is because of Dr. Guido. And he didn't really comment, but I don't think there's anyone in the world who understands elastic fibers and elastin, or extracellular matrix, which is a fancy name for all the stuff that makes up our body that's not a cell. So collagen, elastin, proteoglycans, sugars, everything that are the building blocks of our skin. And it doesn't surprise me that the genes causing PXE don't even, aren't found in the elastic fibers, because it's really like a symphony of activity with all growth factors and collagen, elastin working in concert in this symphony to make our skin do what it's supposed to do. And if any piece isn't functioning, then we have problems. And so I studied with Dr. Wito, with Yoni in his lab, sun damage, elastic fiber damage, and skin aging. So what's the deal with laser surgery? I also started, I wouldn't be a laser surgeon if I hadn't been at Jefferson. Dr. Wito and Gary Lask, someone, I'm gonna call him Yoni, because even though he's famous, we just call him Yoni. He's a very friendly guy, even though he's an MD, PhD, a double doctor. He invited Dr. Gary Lask, probably one of the founders of laser surgery at Jefferson. This is me in the laboratory drawing blood in the bottom. You can see how long ago it was, just like Dr. Wito's picture. I'm actually away at the beach, and my computer's located directly in the sun, but it gives me a good time to introduce you to sun protective clothing. I'm wearing a shirt called Block UV, BLOQ UV. I got these on sale. They're like 20 bucks. I bought 20 of them. They're normally $80. They're very expensive, but you have to wait for a sale. They completely block UV, so you don't need sunscreen where you put these shirts. Brown sunglasses that protect your eyes more, and a hat to also protect your eyes and upper face. And I think if you're having an issue with elastic fibers, you absolutely have to protect yourself from the sun. One of the things I didn't mention, besides brown sunglass lenses, because it blocks the blue wavelengths from reaching your retina, which can damage your retina of your eye, sunscreen every day to expose sites, and UV blocking clothing, is you need clear UV blocking window film in your car. The sad news for most of us is that most of our time outside is spent in the car. And this is probably the most important thing you're going to hear today from me. And that is, you should get clear UV blocking window film on your car. Unless you live in Manhattan or some big city, 90% of your outside time, sadly, is in the car. And so you can have clear film called Lumar, L-L-U-M-A-R. That's one film called Formula One film, made by Lumar. Also, 3M makes a great clear film. You don't need tint, because tint inhibits your ability to see at night. I don't know what I'm doing in this picture. This is a centimeter scale you're supposed to put on the skin. We had a lot of fun in Dr. Wito's lab. I also had all three of my children while I was there. This is what Dr. Wito was talking about. He's Yoni. He is on this paper, the senior lead author, or senior author on this paper, where we look at collagen in this left panel of these three. I hope you can see my arrow, but if you can't, these three in a row going from top to bottom. On the left side is normal sun-protected skin. The red is collagen, the green is elastic fibers, and the combination This is what normal skin looks like. When the sun gets to it, it's the same person. This is their bottom, their butt, and this is their neck. And over here, you see all these elastic fibers are gone. And you get clumps of abnormal elastic material. It's not calcified, but it's analogous to the situation in PXE. And look at the collagen. Your collagen gets digested away. You don't really see that. It must happen in PXE because there's such an accumulation of elastic fiber. You can't have two things in one place. And so if you look down here, this is the picture, collagen in red, elastic fibers in green, normal, and sun protected. This is just elastic fibers. This was also done when I was in Yoni's lab at Jefferson. And this is a laser scanning confocal picture, like a CAT scan through the skin that's been stained for fibrillin, which Yoni's probably the only person that knows that on this talk, because these fibers go all the way up to the epidermis. Elastin protein doesn't go up there. That's a stupid point, but I'm letting Dr. Guido know I still remember a little bit of what I learned in the lab. And this is sun-damaged skin down here. You can see the architecture so bad. It's like the difference between a resilient rubber band and a rubber tire. So that's kind of what we're dealing with. But we have to remember, what are we treating? You know, so many people design lasers. They spend $30 million designing a laser, and it's doing something that we shouldn't really be doing. And yet it goes to market, it gets FDA clearance, because pretty much any device that hits the skin is going to cause some change in the skin, and they get FDA clearance, right? We're not treating a block of wood. The skin's alive, right? So it has to respond to what we do. And I'll just tell you, skin with fragment elastic fibers and calcifications, what we're trying to repair. And elastic fibers are extremely hard. I'm going to say it again, extremely hard to stimulate in the skin. I think, you know, people like Yoni's lab, they're going to figure out a way to do it biochemically or with gene therapy or some really cool way. But with lasers, it is really hard. Because why? When we heal skin, or when we treat skin with a laser and wound the skin and create a wound on purpose, and I'm going to make sure I don't go over my time because I do talk a lot. I'm sure Yoni remembers that. We see each other a lot. Basically, skin starts in a wound, you get hyaluronic acid, you get a fibrin clot, and then you get hyaluronic acid deposition. That's what's in most of the fillers today. Restylane, Juvederm, all these fillers you hear about. Then you get a chondroitin sulfate-rich vascular tissue, then type 3 collagen. And by the way, I learned all this and did all this work in Dr. Guido's lab. And then type 1 collagen. And then maybe, if you're lucky, you get some elastic fibers. It's very hard to create the elastin network once it's damaged, so far. But that's why I think it's important to keep these centers of excellence like the one at Jefferson is probably the main one, to keep those going and well-funded, because they're going to figure out how to counteract this. But we have not yet with lasers. So people, you know, when you're a physicist and you're designing a laser, you think like a physicist. So if I heat something, it'll shrink, right? So I remember these little toys. No one probably remembers these. When I was a kid, they had shrinky things. I don't think we got to buy these. I had a lot of toys, but I didn't have this. You put it in the oven and it shrinks from a big sheet of plastic to these little toys. Now, that's great when you're dealing with a piece of plastic. You can't do that with skin. We stimulate inflammation in skin, and then that inflammation remodels the skin. And this is what I learned in Yoni's lab, like all the conditions where we get deposits of collagen or elastic fibers that don't belong there, or we get destruction of collagen elastic fibers, always start with inflammation, always. And we get remodeling. That means breaking down and building up if we're doing things that we want. And you can't shrink skin evenly with a laser. It's just dumb to try. Because first of all, if you damage the skin enough to shrink it, that damaged area is going to die, meaning the collagen gets denatured, the cells around there die, new cells come in and take that bad stuff away. So it just doesn't work. And people forget to think like a biologist when they're a laser person, because it's unusual for physicists to care about biology, and biologists don't care that much about physics unless they're doing laser or radiation therapy or something like that. So it's unusual to sort of think both ways, but you have to when you're treating the skin. So this is a patient I treated at Jefferson in the laser center, which Yoni started, and I got to be the first director of it. And you can see that we've done a lot for this person's sun-damaged skin. This is on the face. Facial skin is different than skin everywhere else on the body. And what I'm not showing you is the picture in between here. The person had a 3rd-degree burn over their whole face. We don't really do this kind of treatment anymore very commonly. We do a much milder version of this because of the side effects of this treatment. But it is pretty amazing on the face. The problem is you cannot, and I'm going to say it again, you cannot safely and easily use this on the neck and underarms. Now that doesn't mean there aren't experts trying to use this on the neck, but if you're trying to treat PXE, skin that's got damage in the middle of the skin, the mid-dermis, like Dr. Guido showed, forget it. You're not going to be able to do that on the neck with a laser. Your risk of scarring is too high. And that doesn't mean someone can't show you one picture of having done that. But I bet you they could show you 10 more of problems they had. So I do not recommend CO2 laser for the neck, and certainly not for the body, for treating the changes in PXE. I just think your risk of problems is too great. Now you can use these lasers on the face, but that's not the main site of changes in PXE. And this is also work that was done while at Jefferson in Dr. Guido's lab, where we looked. This is all supposed to be pink in sun-protected skin, but all this black stuff is a stain. It's a special stain for elastic fibers, and these are all damaged. This should be pink. After laser, you see that zone increasing, but again, this is the face. The neck is much less forgiving. This is a laser that, instead of treating the whole skin and leaving you a mess with 3rd-degree burns over your whole face, you just treat little dots of the skin. Now, this is a great example where brilliant physicists, brilliant laser people invented a laser to do something that's not quite doing all they want. Why? Because they postulated, hey, if 100% resurfacing gives those great effects like I showed you before, let's do 20% resurfacings. And that would work great if we're treating a block of wood. But if you're treating skin where the inflammation reacts to the treatment, it doesn't work that way, because at no point, I don't care if you do 20% treatments, you don't have an open wound. When you have an open wound, the risks are greater, but your body responds by contracting the skin and tightening it. And again, that's just the face where I recommend people doing that. So this is a fractionated laser, and you can see from the left panel to the right, there's improvement, but it's much less dramatic than the picture I showed you. So there's a device, a monopolar radio frequency device. We're not allowed to talk about brand names, but I don't know if this is a CME talk, but I actually never followed the rules before. I follow them even less now. So this is a device called thermage, where a device touches the skin, it cools the skin, it puts radio frequency, and the energy goes deep into the skin. So you get heating at depth. And that's because these two electrodes, depending how far apart they are, that's how deep the energy goes in the skin. But you have the same problem. You can't shrink the skin, shrink wrap it like a shrinky dink. It won't happen evenly. And if you crank it up like people that don't understand the skin do, you'll kill this fat layer. So you'll get a divot in the skin. So I don't think thermage is going to be a big help to treat people with PXE. Same thing, this fractionated radio frequency. And so radio frequency, you have needles that go in the skin. Now this you can actually treat the neck with. Probably get very, very, very minimal results, but you'll get some tightening. I'm talking about in PXE skin. In photo damage, you can use this. Multiple treatments will give you minor improvement. In normal sun damage, you can definitely get improvement. In PXE, skin affected by PXE, I don't think you're going to see enough improvement to justify a big expense. But what is cool about it is it can deposit energy deep down, cause this disordered collagen, little tiny dots of disordered collagen, and the body responds to that with inflammation and some remodeling. I think what needs to be studied in PXE is if you have this kind of alteration in this protein, are you going to get remodeling that is what you want? Whereas in sun damaged skin, you're more likely to get changes, where you get normal collagen deposition. So it's not even known if this is going to help or if it even could help patients with PXE. But this is the things that don't work. I'm going to tell you what will work. So please, and Yoni showed you some of that. This is an electrode that actually goes under the skin. That wire is right here, is an electrode, and this is a sensor here. And this is another electrode, and the kind of current passes between them and causes what you see down here is heat. This light color in this color picture is heat. It heats the underside of the skin. I would not recommend this for PXE as well, but you can see a little improvement of the contour. And actually, this is a decent number, level of improvement, but these are the better pictures that you're going to see. And it's not going to make a big change in very loose neck skin that you see from PXE. So one of the concerns, and it was great that Yoni shared me the communication with your fearless leaders at the PXE Society, is I hope this guy coming to talk about laser isn't going to say how great they are, because people go out and spend money and they're very disappointed. And I completely agree with that. I'm a scientist and I do what works. I learned that at Jefferson. And so I use the lasers that I know are going to do what I want. And so I would not treat people's neck skin with laser at PXE. This is focused ultrasound. It's sort of similar to the other devices that damage collagen, except the purpose of this is to go all the way beneath the skin and kind of tighten what's called the SMAS. It's an area of connective tissue that they lift in a facelift. The problem is it's not an even sheet and it's not always in the same place. You can't shrink it like a shrinky dink. So this may produce some improvement in some people, but I just don't, it doesn't give results that this or Thermage, that are, for me, something I want to use in my clinic. Now that doesn't mean that all the people that say it works, it works for them and they get some good results. But when you're talking about treating skin that's lax from PXE, you're talking about the neck. And I just don't think you can get the changes for what's going to make most people happy with PXE. That doesn't mean there aren't people out there that see great results and patients that aren't happy. But since I'm the one talking, I tell you what I use, and then you'll get other people tell you what they do. And then you can sort of decide what you think. Because that's really because there are many things that do work. Yoni mentioned the injectables. The injectable fillers today, since are mostly hyaluronic acid. There are other ones, calcium hydroxyapatite, that's like bone material. That's what people with PXE are getting in their skin that they don't want in the first place. So I probably wouldn't recommend that. And I also wouldn't recommend the other fillers. They don't last as long as the collagen. They probably don't last as long as a year. There are fillers for the face that are made of like Vicryl suture, poly-L-lactic acid. And that filler, it's called Sculptra, can plump out the cheeks, but you don't use it on the neck. People do use it on the hands sometimes. They use calcium hydroxyapatite, which is the bone-like material. But again, fillers are temporary. There's no way you're going to put it in the underarm skin and the neck in amounts that are enough to make an improvement. Now, one thing people can do in the neck is, you ever see people that get like these linear bands in their neck from the muscles underneath? Those are called platysmal bands, because the neck muscle down on your neck is called the platysmal muscle. And those can be made to disappear from Botox. But that causes actually the skin to relax. And with PXE, the skin's kind of too relaxed. So, and I'd be happy to come back sometime and just give a lecture on, hey, I have PXE, I also have skin aging. You want to tell me about how Botox works and fillers work? I'd be happy to do that. But today we're talking about how it works in PXE. And I don't see a place. And they're very, very, very expensive, the fillers. And you're going to spend a lot of money, and they disappear. Now, they are great for the face, but for the neck and underarm, it's not the way to go. This is brow lift from Botox. This is a great study, but look at these measurements. I mean, you got to measure this closely for lifting. I mean, it works. And Botox is actually amazing. My forehead looks like something else Dr. Guido studied, Shar-Pei dogs. They have a defect. I don't know if it's fibrillin or fibulin. Yoni will know, because he had a really cute. Do you still have a Shar-Pei? I don't know if he does.
Now I'm muted.
What was it? I'm sorry.
Anyway, now don't have any more.
My forehead looks like a Shar-Pei dog, and they're really cute, and they have elastin defects. So it makes my forehead lines completely disappear. It does work. But again, for PXE, I don't see a role for these things. And one thing I noticed that I think Dr. Guido noticed too, the plastic surgery literature, I'm just going to say it sucks for PXE. I didn't really find you know, there's all these older papers, stuff's not even spelled right. Now that's not fair because they're from foreign places. But, you know, the US is one of the leaders in the world in medical science and research. And we really don't have any, you know, decent sized series or really good articles in PXE and plastic surgery. And plastic surgery does lift the skin. You can excise. I saw that article too with the Z-plasty. That's basically a fancy way of cutting out skin, as Dr. Guido showed. Just you make a Z in the skin to pull it together. Now, there are things that can be done. Plastic surgery really works. I'm going to put it out to you people in the audience. We need help, and I'm going to do the same, by the way, because I'm new to this sort of fight. And I want to find plastic surgeons that have experience in treating PXE. And if there aren't surgeons who are experienced, we should find the best surgeons and stick a gun to their head and say, no, bring a bouquet of flowers and some wine and chocolate and say, listen, guys and women, let's focus on treating people with PXE with plastic surgery because it works. Now, what are some of the problems? Neck and facelifts work great. It's hard to get a neck lift without having a little bit of a facelift, just geometrically. But they really work well at tightening neck skin, right? One of the issues that we're seeing in a minority of patients in a 9-case series, a 9-case series is small. I want to see like a 30-case series, or from overseas, a 50-case series, where everybody comes in, or whoever wants surgery gets it. But there was some instances where the skin was easily torn. The skin didn't heal very well. Big scars formed from inflammation, keloid scars, but this was in a minority of people. And 9 of the cases were followed for up to 15 years, and the results persisted. So surgical results persist. But you know what? They're not going to persist if you don't protect yourself from the sun. Sunscreen, window film in the car, keep hearing me. Because if you have an elastic fiber defect, you got to protect yourself from the sun. Face and neck generally heal more quickly and with less scarring than the underarms. So the scars from like what's called like an arm lift, you know, an arm reduction basically, where you cut out some skin, the arms can scar pretty badly, but you know what? We can treat scars. And so, hey, what am I doing here? So these are some of the pictures from some of the articles, and you have up here to down here. And you can see, I don't know if this person's scratching or what's going on. These may be residual scarring from the treatment they had. Again, up here and down here, you see, you know, there may have been some difficult scarring, but we can help that with steroid injections. And actually, that's an area where laser can help in fixing scars from surgery to reduce the skin. And so here, and I don't even know what they did here. Here's the scar. I got to tell you, you almost never see a scar heal like this from a brachioplasty, from a surgery to reduce an arm. This is not an area that heals great. And this scar looks like it's kind of not that done healing yet. But you can certainly see a reduction in laxity going from here to here. And I guess it's from here to here. They claim they did something also on the neck on this patient. I guess it's a little bit better from this panel on the upper left to the panel on the lower right. I assume you get variable results. But this is what we can do with scars. I mean, scars, we can do a whole ton. This is a laser surgery went bad at an office in Jersey, and they came to Jefferson. And, you know, it's funny. I made this person better than what's in this picture. Doc, I'll do anything for you if you make me better. Just come back for your last picture. You don't have to do anything else. They never come back. So every picture is one picture before the last treatment. I know you all will come back if I help treat your scars. This is a scar from skin cancer surgery. Surgeon did a beautiful job. You can't help this. This is broken blood vessels. These also come when you get injectable filler, and you can see a beautiful thin scar. I will end on time, and this is on time. Lasers and other energy-based devices such as RF and ultrasound can produce minimal skin tightening on the face and neck, and probably will not produce acceptable results in skin affected by PXE. So don't spend a lot of money on that. The CO2 laser produces some very significant tightening on the face, but downtime can be significant, and skin is much riskier to treat on the neck. So you really have to be careful on the neck. There are experts that do this, but just by nature, I'm conservative. And I would say if you already have PXE, don't get your neck treated with CO2 laser. Lax skin is best corrected with plastic surgery on the face, neck, abdomen, and extremities. You can treat all those areas. People that rapidly lose a lot of weight, they get stomach reductions. Since COVID, I lost 20 pounds walking around the block with my dog and my kids. And they get neck reductions to take out the loose skin. Neck reductions, arm reductions, stomach reductions. It works. Skin affected by PXE may be more likely to scar following plastic surgery. That was what I saw in some of the pictures. The medical literature has very few cases of PXE with plastic surgery, being improved, and that's got to change. I was very disappointed to see that. And it would be helpful to have a list of plastic surgeons who've treated PXE, or at least reach out to some surgeons to get them to treat PXE. So I want to thank you, and I don't even know if I have time for questions, or probably have a lot of questions for Dr. Guido. He's the world's expert on this topic. So thank you for including me. I really appreciate it.
Thanks very much, Eric. We do have a list of plastic surgeons who have treated PXE over the years, and in fact are looking at getting records so that we could put together a much better series, because we also have a lot of plastic surgeons who refuse to treat PXE, saying it's too scary because of healing, which is not at all an issue actually. And we would like to see more surgeons be open to treating PXE. I have a list of people asking me in just about every state to find them a plastic surgeon. So we do have time for a little bit of questions, because I'm willing to go into our break. If you guys need to walk around while you're listening, feel free to do that, stretch, whatever. And we'll, at the top of the hour, move into the eye. But let's have some questions if you have them. And you can put them in the chat. You can raise your hand by clicking the little hand, or you can shout it out, and sometimes that causes chaos, but we can live with it.
There are no immediate questions. Let me ask Dr. Bernstein, how about some topical applications for PXE skin? Do you see any role for those kind of things that have been used for cutaneous aging?
That's a great question. And actually I do. And we did the studies in your lab. You're on them. So basically you can, he's got like probably 4,000 publications at least, something like that. I don't know how many now, 5,000. But you can thicken skin. You can make skin create hyaluronic acid by adding retinoids like retin A or alpha hydroxy acids like glycolic acid, for example. And if you're going to use a retin A type medicine, retinol is over the counter. I don't think it works as well. I think the prescription ones work a whole lot better. You can thicken skin, and there's nothing to lose by doing that. So the answer was, I think you can get improvement. It's inexpensive, and it certainly improves photoaging, which everyone has anyway. That's a good point.
Menu bar, Zoom meeting to navigate, press left or right arrow. Audio now unmuted, leaving menu bar.
Matthew, can you take care of the muting there? Another question from the chat, are the risk of needle scarring or broken veins higher if the patient is having injectable collagen fillers around the face?
Yes. So, and nowadays we don't use collagen, we use hyaluronic acid and this Sculptra, which is deep. But most hyaluronic acid fillers do cause extra blood vessels. So they're not, they're just growth of extra blood vessels, because you are stimulating kind of new skin underneath. And that's what the topicals do. They stimulate hyaluronic acid. So extra blood vessels do come from injectables. Fillers, but they're easy to remove with laser, like 1 or 2 treatments. By the way, I love your Saturn V rocket in the back. I see up on your bookshelf over there. Very cool. Very cool.
Other questions?
Olga.
Go ahead, CJ, do you have a question? Okay. Dina. I think you're muted. There you go. You're muted, Dina.
Sorry. Okay. I think Dr. Bernstein said something. There was some laser that was okay to do on your skin. but not your neck. But I thought that around the mouth, you know, and also inside of the mouth, right? There is PXE in a lot of people. You know, these.
Audio now unmuted. Leaving menu bar. Zoom meeting.
Hold on, sorry, we're gonna see if we can.
So those lines you showed, they have a name. I have them two marionette lines, and those are often most commonly fixed with injectable filler like hyaluronic acid. However, CO2 laser around the mouth, if you're just doing the mouth, the risks go way down, you know, risk of infection and all these things. If you have a history of cold sores, you have to take a medicine. But I don't see why CO2 laser to treat wrinkles around the mouth wouldn't work fine in someone with PXE, but it's PXE doesn't usually affect there, does it, to my knowledge?
Well, I think a lot of people have it around the chin. I think I do to some degree.
So we did a paper, Mark Lebel and I, and he called them mental creases, this line here. And there were a propensity of them in people with PXE, and they're also in people who with aging as well. So I'm not sure whether they would be considered a classic sign, but they're in people.
Audio now unmuted.
CJ, if you can hang on a second and stay muted till we finish, that would be great. So anyway, Eric, any further thought on that?
No, I was saying that I don't see a reason people with PXE can't get CO2 laser around the mouth to treat changes that are associated with either PXE or damage to elastic fibers by the sun. I would imagine it's synergistic with the sun, but it's, you know, it's interesting that it only affects the neck, but the neck ages differently than the face. Even if you look at broken blood vessels on the neck, people like me who are light skinned and you get rosacea on the face from the sun, you know, blood vessel growth from the sun. And the vessel growth we get on the neck has a different name, poikiloderma, POC, poikiloderma savant. But it's just very different. The vessels are different. The way you treat is a little bit different. They're leaky. You get pigmentation. The face is different. So I think the aging of the neck is different than the face, and the healing of the neck is different than the face. So the face is very, very forgiving. You can do a lot to the face you can't do to the neck.
Great. Thank you very much. CJ.
Zoom meeting. Audio now
Okay.
unmuted.
Here we go with the keloid skin. I have terrible keloid skin, and I've had shots to try to stop the itching and the pain that comes from it. Do you have any suggestions of how to treat? I've had creams, I rub. Any patients that you've had that have
With
had
keloids?
success with keloid
So yes. So
scars?
yes, I have dealt with a lot of people with keloid scarring. Where huge keloids come from is from cutting out smaller keloids. Keloids are really a problem of inflammation. It looks like a ball of collagen, right? Looks like a tumorous growth, which it is, but
Right.
it's stimulated by underlying inflammation. That's why it itches and that's why it hurts. And so the way to treat them, unfortunately, is with injections. And there's a couple different things that are injected.
Join the meeting.
5-FU and very high strength steroids, 40 milligrams per mil of Kenalog, which is a steroid. And you have to you keep injecting. So for the first 4 to 6 months, you may not see much improvement, but then over time, it starts to get better. And people often mix steroid medicine with 5-fluorouracil, but that should not be used, in my opinion, in people of childbearing age, because it's the same stuff you put on your skin to get rid of precancers. It's like a topical, it's a chemotherapy type thing. But when you inject it into a keloid in small amounts or put it in a cream on your face, it treats sun-damaged skin and it reduces the inflammation from the keloid. Once the keloid's flat from injecting, then it can be treated with a laser, because steroids will shrink it. That's a positive thing, but they also cause more redness than you started with. But we don't care about that because redness is very easy to remove with a laser. All the redness and extra veins, those are easy to get rid of. We laser away the veins. The laser also improves the contour once they're flat. Don't get laser when they're big and thick like that. You're just wasting, throwing money away. And never treat keloids with laser when they're thick, because it's just a waste of money. It's not going to help until you shrink them with injections inside. So you just have to stick with that and be persistent and find somebody who's good at doing that. I don't really know another way. I mean, there's, you know, for really severe cases, radiation therapy and other things, but that's kind of second and third line treatment when everything else has really failed. I hope that helps.
What type of injection? Is there a certain type of injection?
Now unmuted.
Kenalog steroid, TAC-40, triamcinolone, usually 40 milligrams per mil, and they mix it with 5-FU, which is actually like a chemotherapy agent, the same type that people rub in a cream on their face to get rid of precancers. So people will often mix those, but I would never use 5-FU in someone of childbearing years, you know, for fear they could be pregnant. But I'm very conservative, you know. But those are the two main things people inject into keloids to make them shrink.
Okay, well, thank you very much, both Yoni and Eric. And it was pretty funny, Eric, that Yoni forwarded my not tactful email of, this guy better not tell everybody to use laser. So
I love that, and he knew it. He knew I would love that. And you know what? You're 100% right. You know, it is very hard. In Yoni's field, it's not that hard. You know, basic researchers, they're scientists, they tell it like it is. In my field, there's a very big range of, from basic scientists to, you know, people that did 8 months of beauty training to who knows. And so, you know, the feedback you get can be all over the map. And the papers, you know, getting one paper into a journal like the JID takes, you know what it's like, it's horrible. Or even these bigger journals, Lab Invest, whereas in our literature, it's you know, the bar is a little bit lower, the impact factors. They're still rigorously looked at, but it's just, you know, it's not the same.
yeah, cool. Well, thank you guys very much.